Good morning. So today's class we are going to discuss about the plasma volume expanders. Yes, plasma volume expanders. Now, what is meant by this plasma volume expanders? What are the different types? All those things we are going to discuss about these classes. Now, fluid therapy. Whenever we are talking about the fluid therapy, it is important as a therapeutic maneuver in the managing surgical, medical, or the critically ill intensive care patient. That means when there is a loss of blood and all, you can say that we are giving the drug, or into the other medical condition also we are giving the agents which is act as a plasma volume expanders. These plasma volume expanders, it is a hypo-oncotic or the hypertonic fluid. Let osmotic. Now, oncotic means this is the osmotic. So, hyper-oncotic or the hypertonic fluid that expand the circulating volume for more than the isotonic or iso-oncotic fluid. So, blood pressure. Again, it is important for the blood pressure. So it is expanding circulating blood volume for more than the isotonic or iso-oncotic fluid. Topically, if we are telling, usually the colloids are used to expand the plasma volume. Majorly colloids are used to expand the plasma volume. Although combination of the hypertonic, that is crystalloid or the colloid, have been used recently. Now, plasma volume expanders are used for the treatment of the circulatory shock. Clear? So this is important for the treatment of the circulatory shock. They are restored vascular volume, so they will be helpful to restoring the vascular volume, stabilizing the circulatory, that is the hemodynamic, and the maintaining the tissue perfusion. Now, the two general category of the expanders which are used, that is the crystalloid and colloid. Here, crystalloid and colloid. Sometimes mixture of these both can be also used. Now, currently available colloids. What are the currently available colloids are there? There may be varies in their physiochemical, pharmacodynamic, or the pharmacokinetic parameters or the property, and mainly their molecular weight is different, and you can say that this important because their duration of action, or you can say that their ability to expand into the plasma volume, all those things, it is depends on the plasma volume. Now, if we are talking about the plasma volume expanders, what are the ideal properties of the plasma volume expanders? So they should exert the oncotic pressure comparable to the plasma. So you can say that they should exert the oncotic pressure to comparable to the plasma. That is the important one. Next, it should be distributed into the intravascular compartment only. So they should remain into the circulation. It is not like that after giving they will go to the any other tissue or leak out to the any other tissue, or to be rapidly disposed. That means they will be should be there into the circulation. They should be pharmacodynamically alert. That means they should not have any pharmacological activity. They should not should be pharmacodynamically alert. That means they should not have the any pharmacological activity. They should be non-pyrogenic. That means they should not cause the you can increase the temperature. Non-allergic or non-antigenic. They should not be interfere with the blood grouping or the cross matching. So they should not have any interference with the blood grouping. Then they should be stable. They should be easily sterilizable and should be cheap.